Today, we're really trying to make sure that it's the nurses that lead that navigation in the most skilled, most competent, highly educated manner. There are different roads to nursing. There are different degrees one can get. At Chamberlain, where I work as the Dean of Academic Operations, our goal is a BSN. We want the baccalaureate level to be one of the standards of expectation for nursing. We have masters in science of programs. We have family nurse practitioners, which Carmen is a phenomenal role model for what the advanced practice registered nurse can bring to community health settings to really serve the populations that are needed to be served in a most skilled and competent manner. We have the highest levels of academia programs. So nursing is here to stay, as you say, and we're not going anywhere. And we really do want to lead it in the most skilled and competent manner that we can do. The RN supply, again, is expected to grow by 952,000 in 2025. Again, I'm hoping to be around. I'm hoping to look good still and think well still and be a part of the community that continues to inspire and motivate and move in that healthy direction that we all want. As I said, CMAs, I love certified medical assistants. I have some of the best colleagues that I've worked with. We all know Latino education, and LEI. I just did their keynote speech, so I met the most wonderful phlebotomy people that are going to that graduated with a certification, the most wonderful certified medical assistants, licensed practical nurses, and all and some that aspire to fit right into the healthcare system that we need. Our extended care facilities are some of the most important places that we will serve as nurses. We need good, skilled, competent, technical skilled people that need to be supervised, and how do you move that workforce with humanity. If I'm the older I get, I want to be well. And if I'm not well and I don't know you anymore, but you knew me, then make sure I say to my patients, or I tell my staff in the past, make sure they're well, they're kept clean, and they're respected. Because that's where, we need to be as a workforce. We need to be I heard compassion earlier. That's what nursing is about, but so is all healthcare. Your leaders at that top level, the Cook County Hospital and Healthcare System, when you have an HR person, they set the standards of who they let into their hospital. They have to look at your bios, they look at your resumes, they look at everything. We do all kind of background checks today. I hired an individual that I couldn't get on board yet because until that background check comes through for our standards, you can't get a position to touch humankind. At least that's what we should do to make sure. But we also need to figure out what the standards are when you say you have a workforce that is diverse. What does diverse mean? Don't hide behind numbers of others when the climate that you're serving. I was at Norwegian American Hospital yesterday. We did a presentation on prematurity awareness. One of the things about Norwegian that is very pivotal is that OB population is 90, so this is where you know your community, 90% Spanish-speaking, bilingual, bicultural. So why would you not, as an HR person, make sure that the people entering your system are competent, skilled, can read, can write, can set the standards and the expectation to give the care that you need to give to the population that you're mirroring. So that comes from above, it really does. And it comes from both places. So I always tell nurses, at the bedside, you're the biggest advocate and the lobbyist for life. And you take that to your leadership and you expand it, but all nurses need to get involved in all types of advocacy and lobbying. These elected officials is who they want to hear from, because you're the ones that live in their districts and you're the ones that know what's happening. And then you go to your leadership, your senior leadership. So I had a slide, pero I don't know what happened, so not that I can blame it on Millie, right? my right hand. So we had all kind of different nursing careers, and I heard them a lot from Marta. So if you heard all those positions, those are the careers that are open to nursing and allied healthcare workers, okay? In counseling, right? Military, childbirth education, of course, one of my passions, clinical research nurse, your family nurse practitioner, you kind of heard that. All the specialties, history. I can tell you, I thought I was going to be one of the finest pediatric nurses in the world because that was my passion. Spent years there at Children's Memorial Hospital when it was called Children's, right? And then it went to become Lurie. Spent a couple years at Northwestern in the emergency department, in the ED. You know, spent a couple years in OB, women, labor and delivery, nursery, special care, mother, baby, gynae, oncology. I was a director of nursing of a women and infants children's clinic, community wellness. I worked at the fantastic Erie Family Health Care Center. Talk about passion of serving the community and giving with your heart and soul. So I was a director of nursing of perinatal and healthcare of women's services in a phenomenal hospital that is part of the workforce that's merged, right? And we set standards, and you lead a workforce that, excuse me, when you're right, if my physician says, I don't feel like taking a timeout, we take a timeout. The standard by my hospital is set that in this nation today, for safety reasons, we pause and we take a timeout before the patient has surgery. We do an identification, we pause. Who's in the room? Representative Willis is in the room. Who's in the room? Mireya is in the room. They're all masked and covered. No one cuts the patient, puts the patient under. And that's a team. But it takes your senior leadership to set that standard, and one physician that says, eat me, or I'm not doing it, doesn't happen. But that's where you don't allow that to happen as a leader. And when you do, you lose all fours. So we did do that, and I'm very proud of it. I don't see anybody from McNeil here. I think they're in the immigration workshop. But that was a 13-year precedence, and I know we did that. And when a timeout was called, a timeout was necessary. And that's important. When a chain of command, today we hear from Southwest, an employee can stop the bus, the plane, right, from taking off if you smell or feel unsafe. We can do the same in healthcare, but that standard is set at your top, and it's also supported at the bedside. So, you know, think about working in institutions that's where you want to work at, and that's what I tell my workforce. It's what I tell our students. Figure out where you want to work in this nation because the jobs are there, but education is the way you get it. Mi papá decía, you need to be educated if you want to sit at the decision-making table. You know, I used to do a lot of work with Senator Delgado. Many years we worked on his healthcare committee and gave him recommendation and policy and advocacy, advised his constituents, right, as nurses, as people who care. And he would say, if you're not at the table, Susie, you're on the menu. So we can't be on the menu. So we need to be at the table and figure out what that menu is going to be. But it's with education. It really is. All forms of education is the needed. So really for me, concluding is about 3.4 million nurses are in this nation, and we need more. We have a workforce, I'm not gonna lie to you, is retiring, right? They think they're retiring. I think I'm retiring. I think when people say, when are you gonna retire? Well, you know what? I'm thinking of going to school for my DNP. So I'm thinking I'll be a doctorate in nurse practice to take to my grave with me, you know? I'm the Obama generation of, I got 20 years full of loans still left. You know what? They're gonna get paid. And they can get paid slowly by a couple $100s a month, because that's the only thing I will never default on, my loans. But I earned that education. I sweat that education. I have a couple of bachelors. I have a couple of masters today. People say, wow, you really live lifelong learning. But you know what? We want to be professionally developed. We're always gonna be learning. That's why you all are here. You could be out there socializing and having a cup of tea. You're here in this workshop because there's something that you were meant to learn or hear or a message. So for me, it always takes like a simple message or, a simple moment is all it takes for some change to happen. I belong to the National Association of Hispanic Nurses. I am the president of the local chapter here in Illinois, and I sit at the board of the national level on policy and advocacy. And we have programs on mentoring. We have pathways to nursing and higher learning. We have all forms of connection to schools. In Chicago, as we speak, one of our other colleagues is at the Instituto of Progreso Latino. We mentor those kids. And we mentor those kids. Oh, thanks, yeah. And we work with them. So again, another pathway that gives you avenues of how to get into the nursing field or any of the allied healthcare workforce. So with that, we have workforce challenges and implications that we want to continue to look at and continue to talk about and continue to be at the table with great representatives that care. Thanks.
Thank you. Okay, next I'm going to ask Gladys Lopez, Chief of Human Resources from Cook County Health System.
While we're waiting for Gladys to pull up her program, one of the things, actually just yesterday, we had a committee meeting down in Springfield with the veterans homes, and one of the major topics that came up was the shortage of nurses to hire. They actually currently have 40 openings. So if you are interested or know someone, please send them to our veterans homes, because that's where we need some extra help. Thanks.
Buenos dias. Good morning. I hope you're hearing the passion and the voices of everyone at this table, and so mine is going to be equally as passionate about two things. One, the Cook County Health and Hospital System, and two, healthcare professional opportunities for Latinos. So our mission, as you see there, is been and has been to deliver integrated health services with dignity and respect, regardless of the patient's ability to pay. That has been a standing and long-term mission of the Cook County Health and Hospital System. We also have partnerships with health providers. She went quickly, that's okay. And integrated care, yeah. So I'm gonna have to go quickly.
Yeah, we're a little bit behind.
I'm just gonna speak a couple of points on the history of the county hospital, because I think if I just do a quick round of here, how many people have been to the county or are aware of the county? Great. How many have applied to work for the county? See a few, okay. I'm going to tell you how you get in, because it is a complicated process. So we opened our doors in 1835, which again tells you over 150 years of history that we have here in the community. We had our beginnings with our first internship program throughout the country. We did first open heart surgery. We also actually started the antiseptic in ICU. We have the first blood bank, which was named after Dr. Bernard Fantis, and we do have a clinic named after him. And the first comprehensive trauma center was developed in '66, which everybody, if you have family or friends or relatives that are firefighters or police officers, what do they say? If I get shot, stabbed, or hurt, send me to the county, right? So we have one of the best trauma centers in the country. So in 2012, though, or 2002, we had a new building, the John H. Stroger Hospital. And 14 years later, people still call it the County Hospital. So it is the John Stroger Hospital, but we're still the Cook County Health and Hospital System. And our system is inclusive of the Stroger Hospital, Provident Hospital, and 15 community health centers throughout the county. We have 4 regional outpatient centers at Oak Forest, Sangstack, which is located at Provident, the Fantis Health Center and Specialty Center on the Central Campus, which is the Stroger Campus, and the Ruth Rossing Core Center. And I would be remiss if I did not speak just a minute about the Core Center. So it is the largest provider of HIV care in the Midwest and one of the largest in the nation, and it's comprehensive care for patients with HIV and infectious diseases. The staff there are well-renowned throughout the country. We also service, we also have the Department of Public Health, so it's the Cook County Department of Public Health, which is separate than the city. And we also offer services to the detainees at CIRMAC Health Services, as well as the Juvenile Detention Center. So what does this all mean for all of us here? The county serves approximately 300,000 unique patients a year. 300,000 a year. And we have 20,000 patient hospital admissions. And people on the panel were saying how it's transitioning healthcare from inpatient to ambulatory, and that's the same thing that's happening here at the health system. But the goal for that, keep in mind, is what we want to do is have our population be healthy. So we're trying to treat them earlier than at the back end. So at the health system, the reason our physicians, our clinicians, our nurses, our staff are so well renowned throughout the country is we get the most difficult types of patients and cases. They don't go to their doctor, they don't do their follow-up visits. By the time they come to the emergency room, they are in very dire need of health care. And it's something that's complicated. It's not just a wound, it's a wound that's developed into an abscess that's got all these other complications to it. So the next slide real quick. Oh, wait a minute. Hold on. Where'd you go? Sorry. Sorry, I'm trying to go quickly here because I want us to hear Carmen. There was one slide actually before. You could stay there though. In 2016, actually next month, or this month, right? This week. Yes. December 1st. So we're going to break ground on a new building. So that's the one that's at the lower left, which is why I made sure that we put it on there. It is going to incorporate the Fantas Clinic, which is an older clinic now on the campus that we have. And we're really excited about this. It's also going to house our administrative offices. And if anyone's been in our administration building knows that we really need new space. So the next slide we can, so this is our system. What I want to show is the complexity of our system. So we have a plan. So we have our own managed care plan, which is called County Care. And then we also have our public health team. We also have the direct patient care, which is through the hospitals and ambulatory settings. And I think it's interesting and critical for everyone here to know that the commitment of our staff is beyond compare. We have individuals that are department and division chairs that are being recruited throughout the country, but they stay with the health system. And why? Because the health system gave them their first residency. The health system treated a family member. The health system has some connection to them individually, personally, related to their family, and so they stay with us. And we are excited and proud of that. So the next slide just speaks a little bit about the county populations, and currently 25% of the residents in the county identify themselves as Hispanic or Latino. So the next slide is actually another reason why I'm excited and passionate. Dr. Jay Shannon is our CEO, and in our strategic plan, one initiative that he has is to improve health equity by strengthening our workforce to increase bilingual healthcare workers. So we have opportunities for practically everyone in this room except the two that are already employed by us. But we have opportunities, and our opportunities have been changing over the past few years as healthcare has changed. So these are some of the sites that we advertise our positions on. And I just want to spend a couple of minutes on the types of positions. So Marta and others have indicated there's clinical and non-clinical positions. And so the clinical are approximately 65% of our workforce. And we have non-certified, such as patient transporters and ward clerks, certified, which are technicians, technologists, medical assistants, interpreters, licensed, which are clinical case managers, dietitians, mental health specialists, our nurses, and credentialed, which are physicians, physician assistants, and advanced practice nurses. So the non-clinical, you don't have to have a license or be certified to work in a hospital. And so we have administrative assistants, accountants, auditors, billers, business managers, office supervisors, call center customer service representatives, clerks, coders, directors, engineers, plumbers, I'm trying to think, carpenters, and then in the areas, administration, admissions, audit, compliance, environmental services, finance, food and nutrition, health information management, human resources, IT, integrated care management, which is a new area, medical staff office, which is credentialing, quality, and security, just to name a few. The one thing I do have to share is that we are a county entity. We are therefore faced with having 12 unions within our organization and 26 collective bargaining agreements. So about 90% of our employees are part of a union, and so I think it's critical, as candidates know, if you're applying for a position, 9 times out of 10, it will be a union position. So this is where I want to spend as much time as I can, the application process, because I know it trips people up. I have this as a handout as well, so at the end I'll share that with you. I don't think I have enough for everyone, so if you can just jot your name down for me and your email address, and I'll make sure to get it to you. But our website is there, and it's the careers page. Go to the next one. And so if you look, this is our website. At the top, you'll see the careers tab. You click on that tab, and then it'll take you to our careers page. At the bottom right, sorry, go back one more. Sorry. You'll see application process. Click on that link, and then it'll take you to this screen. The reason I circled application instructions, I'm not sure if you can see the red circle, is on our website is what we call a click-by-click guide. It gives you the instructions of how to apply on Taleo, which is our online applicant tracking system. It is critical. I highly encourage, I actually have some copies with me today as well. Review the guide before you apply for any position at the health system. Keep in mind, when you create a profile in Taleo, it not only is for the Cook County Health and Hospital System, it's for the entire Cook County as well. So if you're interested in working for the Forest Preserves or any other county entity, your profile there will also give you opportunity to apply for other positions. Next one. The one thing that trips many candidates up is when you go to our website and you're going to apply for a vacancy, you'll see two links. One is for non-county employees and the other is for internal. And many candidates feel if I click on the internal, I'll get inside faster. No, you won't. Unfortunately, you actually may knock yourself out. So if you're not an employee of the Cook County Health and Hospital System or the county, do not apply on the link that is for internal candidates. Because what's going to happen is you apply for a position, we look if you're internal, if you're not, you get set aside. And we may not call you because you applied to the incorrect link and posting.
That's what happened.
So now the next few slides walk you through the process of when you apply for a vacancy and you would create an account, and then at the bottom you would sign in as a new user and register, and then you would click at the bottom to register. Again, I have these. So the next couple of slides walk you through kind of like the flow chart of how do you apply. And again, it's critical that you read and understand this process because it is very prescriptive for us at the Cook County. The reason for that is, I don't know if anyone's heard or aware of something called the Shackman Consent Decree. Michael Shackman sued the city and the county back in 1960-something, fast forward to 2016. The Cook County Health and Hospital System, like many entities, has an employment plan that we had to file with the federal court. That plan directs the process by which we fill our vacancies. It is very prescriptive and it is very monitored. So that's why it is critical that you follow the directions. One mistake, if you don't finish clicking on your electronic signature, the application doesn't get submitted. If you don't apply to the correct posting, your application doesn't get submitted. So it's very critical that you follow the process as identified. You can skip the next ones. Okay. Yeah, go more. One more. And so here are some application submittal tips. Again, review the guide. If you're not a county or CCHS employee, please do not apply on the employee link. Select the non-county employee link. Keep in mind positions, the posting date is listed on every posting and it's generally for 14 days. Don't wait till the last minute. We unfortunately do have technical issues and sometimes you're trying to apply, either your server doesn't work or the posting comes down exactly at 11:59 p.m. the day it says it will. So just give yourself enough time to prepare before you apply for a position. If you're interested in more than one position, unlike our competitors, I can't consider you for anything other than what you apply for. So if you want to apply for a nurse in med-surg and you only fill out that application, but you also have ED experience, but you don't apply for the ED, I can't consider you for the ED unless you applied for that position. So is that helping everybody understand why things are happening at the system? So it's critical, again, keep in mind what you're applying for, jot down the posting number, keep record of it, keep track of what's going on. Review the posting, make sure you meet the minimum qualifications. We have candidates who respond, they have a bachelor's degree. When we validate they don't, they will not be contacted. So make sure you meet the minimums, make sure you answer accurately. And then if you are a veteran, the county has an ordinance that we do have veteran preferences. So anybody that is a veteran that provides sufficient documentation will be guaranteed an interview if they meet the minimum qualifications. If you have a foreign degree, please make sure you get that translated. It is required for us to review it, make sure that we have that. And again, I also provide the recruiting hotline number in the event you have any questions. So where we see candidates really get tripped up is when they receive the notice of an interview. And I will say it may take anywhere from 1 to 3 weeks. And I'm kind of sad I have to say this in front of some of my competitors, but it will take 1 to 3 weeks before you get a call. So do not be discouraged by that. I also need you to keep in mind when we post a position, we get thousands of applicants for those positions. So people still want to work for the county, which excites me, but it is quite a bit of work and it takes us quite a bit of time to get through that candidate pool. So read your email confirmation carefully, verify the date, time, and location of your interview, confirm who you will be meeting with, provide enough time to arrive to park and reach the interview. We have a large campus, so depending on which building you're going to, it'll determine where you would park. Arrive 15 minutes before your interview, bring all the required documents. If our posting says bring the document at the time of interview, you do not have that document, you will not be considered or forwarded on. It is critical that you comply with everything that's listed in the postings. And then also research the organization, research the health system, ask questions of our managers, of the interviewers, so that they know that you are not only interested in a paying job, but a career with the health system, and that you're as passionate as we are about working there. Prepare for the interview. Respond to questions with examples of how you've performed the job past and currently. Our interviews are very structured. When you walk into a room for an interview, you will most likely see anywhere from 2 to 5 people. Do not be intimidated by that. We are required to have at least 2 people, which are the hiring managers, on an interview panel. We sometimes have somebody from the compliance administrator's office related to Shackman consent decree monitoring the interview. There also may be someone from HR monitoring the interview. So if you walk into an interview, do not be intimidated. Understand that is a process that's required of us, and it's just to make sure that we are not actually allowing political factors, no offense, political factors to play a role in allowing candidates to come in, because that was one of the complaints. It's only if you knew somebody that you were able to get a job with the health system. So that's why we now have these controls in place. Questions are asked in the same manner, in the same way to every candidate. So if you did not understand the question, ask them to repeat it, write it down, make sure you understand the question being asked. Generally, the question cannot be rephrased or changed, so it's critical that you understand what's being asked. Think through your answer, respond clearly, and again, make sure that you ask questions. So you can follow up and check with HR on the status of your interview. Again, we say about 3 weeks, and I provided the recruiting hotline number. There are certain postings that will say, if you don't bring the documents at the time of interview, you have 48 hours. This is why I strongly encourage that you look at the posting as far in advance as possible so you can get all that documentation. Sometimes now actually schools are better about giving you online your transcripts, but 2 or 3 years ago it was primarily by mail and it would take quite a bit of time. So please make sure that you bring everything with you at the time of interview. I'm not going to read this next statement, but so
Have no pull.
it is a standard language that you will see throughout the application process. And again, it just goes to the fact that no political factors will be playing a role in your selection, your application, or your identification for a position with the health system. Now, if you happen to work directly for a politician and they write a letter saying, I know Gladys, she did XYZ for me, that's acceptable. But we can't have, say, Legislator Kathleen say, oh, hire Gladys, I know her. So that's the distinction, okay? And it's very critical because the health system in the county have worked a lot over the past few years, especially under President Preckwinkle's regime, to make sure that we do not allow political factors to play a role in hiring. It's made it tremendously easier for us because I wasn't with the system, but I heard someone would show up and say, oh, I'm your director of accounting. I don't have an accounting degree. I don't have finance background, but I'm your director of accounting because I know Gladys Lopez and she's commissioner, whatever. So it's been significant for us. But by the same token, it's added a little layer and slight confusion for individuals who are not aware of the county and how to apply. So I want to make sure that everyone understands the process. Again, I have handouts. If I don't have enough, just jot your name down, your email address. I'll make sure to get them to you. But we are really excited. The one thing I will say is, yes, we are doing customer service training for our staff. And we're going through a transition like many healthcares. Unlike, I think it was Marta who said she's been through 4 and 8 years. The county is the county. We've been here, right? And so depending on what happens next year, we hope to be here and plan to be here. And so we do have a lot of opportunities. Right now alone, I can tell you, we probably have at least 300 vacancies posted on our website. So please go to our website. Please apply for our positions. And if you have any questions, I will be here throughout the day. I will be more than happy to answer them for you. Thank you for your time.
Thank you. And bilingual is key, right?
Yes.
Okay, I'd like to ask Carmen Velasquez to come up, who's going to give us an update on the Health Illinois, but I really want to say that Carmen has been one of those pioneers in our community, not only with bilingual education. She established really the first healthcare organization that is completely bilingual. When it comes to bilingual, it's alivio. And that's thanks to Carmen and the work she's done in our community to serve the undocumented and the underserved has been phenomenal. Thank you, Carmen, for all your work.
You're welcome. First, I want to thank you for staying.
Yes.
Really and truly, in 2014, as I was about to transition out of alivio at age 74, I kept thinking about unfinished business. And the unfinished business that I was talking about and feeling an incredible anxiety was about the undocumented. Here we had Obamacare, exclusion of the undocumented. In spite of the fact that I served 4 years as a member of the board of Cook County Hospital, County Care excluded the undocumented. So what is it that we did? We insisted that in the same way that sitting in the front of the bus was a social justice issue, that we, the uninsured, including the undocumented, had to be part of the providing of care or access to care. So for us, it was a social justice issue, and so we called that inclusion. Everybody's talking about inclusion, right? Well, we want to be included. We do not want to be in the back of the bus. So what are we fighting for? We are fighting for, if you know, and many of you were part of this, of the movement that said, hey, all kids is going to sunset June 30th. Well, there were many of you in this room who were part of the movement to retain all kids for another 3 years. It was going to end in June 30th, 2016. Now we have it to 2019. And for all of you who support it, and what I'm going to be asking you at the end of the time that I have, is to become part of the movement. Because, you know what? Having a new president-elect does not scare us. We are challenged, and we have to continue to ask for family care. So what am I talking about? I'm talking about all those who are uninsured right now, including the undocumented, must be covered. And so the mission of the Healthy Illinois campaign is to include everybody, to identify a qualified health care plan under the umbrella of public aid, and we're going to need the help of this House State Representative, and she's going to, you know, we have to have courage, because if we don't have courage, right now, you said, you're crazy. You can't do this. They're trying to kill everything that exists that says you're different, you speak another language, and you know, you don't belong to the USA. And I'm famous for my bad talk. But because I am here at the Latino caucus, I won't swear. Yeah. But I will say this, that we need you. Tomorrow we're going to have a retreat of the grassroots. It's going to be at St. Mary's, and we invite you to come from 9 to 2, because we need to encourage our grassroots, our communities, ourselves, our providers, that you know what? We will obtain access to care for everybody, including the undocumented. Thank you.